Hi, I'm Tom Meyers, osteopath, body-centered stress coach, author, and the founder of the Reaset Approach, a novel and complete hands-on treatment approach that by many practitioners has been labeled as the missing link in their treatment methodology. But what is the Reaset Approach? The Reset Approach can be seen as a three-in-one healing approach with one all-embracing concept that governs and incorporates the principles of, among others, osteopathy, fascia, and craniosacral therapy. And this combined into a full treatment approach without you needing to know anything about osteopathy, fascia, or craniosacral therapy. However, it is essential that you are a practicing manual therapist and have a heart for improving yourself and your skills. For what can the Reset Approach be used? This is the beauty of the approach, and that is that what you learn can be part of a treatment approach for every single condition a patient comes to seek your help with, and can be used as a complete treatment modality to treat chronic pain and musculoskeletal disorders, certain cases of long COVID, stress-related physical and mental health problems, migraines, whiplash, digestive problems, and idiopathic pain or medically unexplained symptoms your patient comes with. However, and this is why you need to be trained and practicing manual therapy. Your evaluation skills and prior knowledge is essential to make sure your patient gets the personal care and attention they need. You are maybe asking yourself now, but what is the difference between the Reset Approach and other treatment modalities? The main difference is that the primary objective of the Reset Approach is to reset the autonomic nervous system. In most treatment modalities, one only looks at the symptoms, or like in osteopathy, the structural or functional dysfunction. But your patient's musculoskeletal pain, migraines, digestive or other health problems may stem from a dysfunctional autonomic nervous system, or what is referred to as dysautonomia. Dysautonomia is probably directly or indirectly linked to some of, if not all of the most common health issues, but only few know how to treat it effectively, and fewer integrate it into their treatment protocol. That is what is different about the Reset Approach. It's its first objective and something that is considered during the whole treatment. I'm sure you are curious now about the how. After the anamnesis, the patient lies supine on your treatment table, and the first thing you will learn to do is to calming the autonomic nervous system and stress response through several hand modalities at the head and neck. The next step you learn is to treat with the same unique treatment modality the secondary compensatory symptoms that have installed over time throughout the body. And this may include spinal manipulations that you'll get to learn. After all that, so to speak, pre-treatment is done. Only then will you address the primary symptoms for which your patients come to seek your help. It is especially at this end stage where you can and need to implement your existing skills. So a question I often get is, how long does a session take? Well, the 3 steps are all done in one session. How long that session takes depends on you, but also your patient. If you become skilled, it can take less than 20 minutes of your hands-on treatment time. Another question I often get is, can you use it straight away? And yes, of course. The material that has been given is immediately applicable in any clinical setting as the backbone on which you, as a therapist, can integrate all your existing treatment techniques, or you can integrate it into your existing method of working. So And as you can see in this feedback I received in the first week after the course in Hyderabad. So the Reaset approach is giving me another dimension. I will put me on the side a little bit to treat everyone in a holistic manner and giving me awesome results. This was in the first weeks after Dr. Lakshmikant got his training. At the end of this video, I'll put more stories I received in those first weeks following our workshops. I will also add a video where one of the students explains how he felt after the course. Anyway, learning the Reset approach changes and expands your way of thinking about health and healing, and explores a new horizon to improve your patient outcomes today and those a fast-changing world with new challenges to their health and well-being will bring. In this fast-changing world, the Reset approach will become a critical component in your healthcare practice. Want to learn more about it? Then visit reaset.com. I sincerely hope to meet you in person at one of the upcoming workshops that are also mentioned on the website. Namaste.
First, I'm coming with confused mind, so I'm did first time this type of approach. Before that, I do high velocity, low amplitude, so many courses. But I see this is a very different type of approach. Actually, I see people healing within the 20 minutes, fully healed, and not only heal, all body feel like energy.
Yes.
That's the thing.
And you didn't only see it, you were doing it yourself.
Yes,
yeah?
myself.
It's like you went through a whole journey in the last 4 or 5 days. And from somebody who was with lots of questions and a bit confused.
Yes, yeah.
Trying to be active and doing. And suddenly when you start to understand, that sometimes doing less and with a softer touch can actually be more powerful.
More powerful.
Once you started to integrate that.
Yes. First, I believe in only trust. People make trust and they're happy. But I teach all people and I show them how to treat the body with very gently and carefully.
Yeah. And you went through this kind of transformation from doing to suddenly calming down and seeing and following. And then suddenly this mind and this heart and these hands were connected.
Yes.
And now this mind and this heart and these hands are going to do magic.
Yes.
Because he has not only changed his approach, he only has changed as a man, as a therapist, as a healer.
This is
what I've seen in him during these days that we were together.
Yeah.
Suddenly, he's calming down. His hands start to be lighter, more vibrant.
Yes.
You're going to go good work.
This is only your blessings.
You have my blessings and through